Good afternoon, everyone. I'm extremely excited about this topic, and I'm looking forward to having a discussion about an inclusive society being a healthy society. Let me just put my glasses on. We are being inclusive. As the world strives to become more inclusive, especially in relation to people of determination, we want to explore the health benefits that inclusion brings to a society. And we want to explore how we can work towards achieving this. So with my esteemed colleagues, I want to dive straight into some questions. Question one for Marinela. Marinela, with your experience within the Butterfly, creating an inclusive employment ecosystem, we wondered why is employment important for people of determination?
Good morning, and it's a pleasure to be here with M42. So, why this is a question? Why employment is important for POD, is important for all. We have been all in a situation when we were out from employment. How did we feel? How did we feel? So we felt that we didn't have financial independence, social inclusion. We felt isolated, and from a health point of view, we have so many people with disabilities, people of determination, they are alienated and they don't access to equal opportunity to employment. And for organizations, because I know that there are so many organizations here, I ask you, why don't you employ people of determination? You are a sustainable company. You care about a sustainable community. If you hire people with disabilities, you meet goals number one. You reduce the risk of poverty. You create decent work, sustainable city, sustainable communities. So for me, we need to really take actions and to give equal opportunity to people with disability to flourish and to be part of the community as anybody else. Thank you.
Thank you, Marinela. And I remember talking to someone recently who said, it's given me a sense of identity. When we think about our work, ourselves, our sense of identity, who we are, and people of determination want an identity as well. So is exactly as you said, I think as you said, why is that even a question?
Yeah.
So I want to come to M42, Suaad, and I wondered, what is M42 doing to promote a more inclusive practice to their work, but also to build a more inclusive ecosystem of employment?
So in M42, the journey has been a journey. So when we started, we had people of determination in the organization, but we did not have a clear strategy or a baseline to start with. So we partnered with the Butterfly, with Marinela, and we ran a baseline to understand where we are in the journey and what steps do we need to take in order to be a best practice inclusive employer. That's the first one. The second one is we have Kevin, a special needs advisor. He helped us a lot because as a human capital team, we're not experienced enough to know how to deal with all different cases. So we need the experts to guide us. And we have POD champions in the organization that work as a link between the organization and the requirements of people of determinations. And they have different requirements. It's not one size fits all. We also have introduced a neurodiverse committee. We have around 22 employees across 9 assets. 50% of them are neurodiverse. And these committees have been meeting, and the people are providing us with input, feedback, suggestions on policies, etc. We have also put our inclusivity statement as an inclusive employer. We're branding that, marketing that. The other element is in our monthly newsletter. Since October, we've been having a section on M42 inclusivity, which Kevin is the editor of, and it has been showcasing success stories, examples, initiatives. It's more of like storytelling, educating, building awareness. And on top of that, we look at different requirements of different people. So for example, we have PODs in one of our assets that require English training. So we introduced that training. So we're part of that journey. It's ongoing. We're happy where we are. It's an exciting purpose. And also I'm in touch with other head of human capitals in Abu Dhabi, and I'm encouraging them also to come on this journey to take this cause forward.
Thank you, Suaad. Now, turning in our society to the education sector, and Dr. Catherine, I wonder, how can the education sector help prepare people of determination or the society for the work environment?
So the first step in education, sadly, still is identification. If we look at our schools across the region, particularly here in the UAE, identification is still very low, and understanding of cognitive differences and different types of functioning and processing is still quite poorly understood. So typically we would look at about 15% of a school-going population would have some kind of special educational need. In Abu Dhabi, we're identifying about 5%. In Dubai, maybe 6%. In the Northern Emirates, as low as 2%. And if we don't see them, if we don't understand them, how can we support them? So educating our teachers to spot, to identify when a child has a barrier to learning is the first step that we need to take still in education. And we've been working on it. There have been huge improvements. And having therapists come to schools like those from M42 or support from organisations like ZHO and the Butterfly to help teachers understand what difference looks like is really important. So I think working on identification is still a huge barrier to begin that journey of support, so that by the time they get to employment age, they're supported, understood, and the pathway is facilitated.
Thank you, Dr. Catherine. And I think, as you can see here, I brought the partnership, this group of people together, because it takes a partnership to be able to change things, to grow things, to develop our society that we are living in, that we choose to live in. But we also need our government support. And I'm very proud of what we are able to do in Abu Dhabi and across the UAE. But Salem, if I can come to you in respect to the fact that you're with Zayed Higher Organisation, what part is the government playing in supporting and promoting inclusivity within the workplace?
I believe the government do a very crucial role in inclusivity, especially putting the laws and setting up the legal and cultural foundation for that. And mainly, as you guys know, yesterday they were like announcing of the Abu Dhabi award for inclusivity. And that would support also the different sectors to include more of people of determination and their workforce. And I think also one of the things that the training for either the employees or the employers, that's part also of what government do, and especially in Zayed Higher Organization, we do training for employers to know more about what the needs or how to facilitate the environment for people of determination in their workforce and their workplaces. The other things also, the reporting maybe, and many other things, but the government doing a great job to do that. And I believe we are in a good situation now in Abu Dhabi and also in UAE. And as you know, there are Abu Dhabi strategy for people of determination, and we just finished the first cycle and they are going for another cycle for the next 5 years. So hopefully that would help a lot. Thank you.
Thank you very much. It's very obvious when you're in the sector, you're seeing the changes and you're seeing the things that are happening. In the time that I have been in the UAE, the differences are phenomenal in growth. And with the support of the government, that announcement from His Excellency the Crown Prince around inclusive awards across all sectors is really, really important. But we recognise that the job is still has many barriers. And I think I wanted to ask all of you, what barriers still need to be overcome to make inclusive practice just a standard practice? I live in dreamland that we won't need a section talking about inclusive society because it will just be an inclusive society. But until we've reached that panacea, what barriers do you feel that we need to overcome to make inclusive practice more of a standard practice within our society? And I'll open that up to anyone.
Certainly, there are mindset barriers. There is a lot of stigma and discrimination still attached to the disability. There are environmental barriers, how our office, as an organization, our community is designed. Although we are progressing rapidly in the UAE with a robust legislation, with the Universal Code of Design, but there are also assistive technology barrier. Now it's the era of the technology of innovation. So we need to progress on this. So there are so many aspects and so many challenges that we have to overcome. But what is the beauty of UAE, I can say, is joining forces, public, private, and third sector, to make sure that we progress in this area and we create a beautiful, inclusive community. So thank you for having us here today.
No problem. Anyone else? Dr. Catherine?
Yeah, and I'll speak to education. As I spoke about, identifying children is our first step, but really stepping back and looking systematically at the educational of our teachers, looking at the BEds in university and ensuring that those BEds are structured to include specific modules on special educational needs so that teachers are equipped, because they are one of our first lines of defense in terms of identifying and supporting children. And if the teachers are better equipped, our identification will improve, our support in schools will improve, the children will be much better equipped when they come to third level and when they come to employment to be successful.
Thank you. Suaad.
From my perspective, I think it's awareness, building awareness, and also the other element is starting. Just start it, do something about it. So recently I've been having conversations with heads of HR in some organizations in Abu Dhabi, and some of them, they were like, oh, it's a good idea to hire people of determination. I was surprised that there are people who have not even taken that step. And we're encouraging everyone now to take this cause forward. And we're very lucky to be in a country like the UAE with our progressive leadership, our wise leadership. So recently the Executive Council of Abu Dhabi met and they had 4 agenda items. 2 of them were related to people of determination. One of them was the Excellence Award that Salem has mentioned. And the other one was related on tracking the progress across all entities when it comes to enhancing the services and the quality of life for people of determination. And also when I went through the details of it, I realized that there are tens of thousands of students that are in our schools in Abu Dhabi that are people of determination. These are our children, our nieces, our nephews, our grandkids. They're going to graduate at some time and they want to give to the community. They want to unlock their potential. So we have to start at some point, and I think having that awareness is a good starting point, being part of the storytelling, showcasing the right role models. And I think schools are doing much better than when I was younger. I didn't have that exposure, the exposure that my kids are having today. So my daughter, for example, when she comes back from school, she always mentions her classmates and people she interacts with. And my kids are interacting with people of determination, which is good. So at that young age, it builds that inclusivity, awareness. I'm not saying it's perfect, it's great, but we are on track, we are on the journey, and inshallah, hopefully soon we see the fruits of it.
Thank you.
I think there are one major barrier also, which is the limited resources sometimes. Even if the government and the private sector and other sectors put a lot of resources in this field, but there are still a big need for resources, not just the funding, but also the workforce and the experts in this field.
Absolutely. And I think certainly how we can look at maturing the insurance systems and resources is really important. But as you say, it's not just about pumping more money in, it's about looking at the quality. There are some fantastic organizations, and working together in a partnership can really make big differences. I just wanted to build on to the point that Suaad mentioned about storytelling. Storytelling is essential about changing culture and changing understanding. Just recently on our M42 monthly magazine, I wrote a large blog about dyslexia, and a colleague of mine who did not want to be identified wrote about her own struggles and challenges with dyslexia, but is not ready yet to identify herself. And I think that's that inclusive society when people are comfortable to be able to say, hey, this is what I've done, this is how I've achieved. But certainly, can you reaching out to everyone else along the group, if we're thinking about the health benefits, can you think of a scenario where health benefits were improved for a person of determination, or for the people who were alongside that person of determination through access to work or education?
We recently had Ragad, a young talent woman, blind, on board, joining the Butterfly. And so Ragad has many master degrees, is a researcher and legal translator, but she was denied the opportunity of an employment for many years. So her health was really affected badly. So she struggled with depression, anxiety. Now Ragad, she's based in Sharjah. She's happy, very happy to travel, not daily, but a few times from Sharjah to Dubai to work with the team. And even if we say, it's okay, you can work from home, remotely. She said, I love to work with the team. I don't feel isolated anymore. So we see the impact on the health of a person. And this can happen to any of us. It's not just about people of determination. If we are out of employment, it has a very big impact on us. So my call for action today for all, please, it's not, and this is where I agree with Suaad, don't think about all the challenges. Start with small steps.
Thank you, Marinela. Catherine.
So in our organization, we work very closely with families of children who have often struggled to gain access to schools. And the stories that we hear from mums and dads of just misery, meeting closed doors again and again, where schools will tell them, we cannot accommodate your child. It has absolutely detrimental effects on the whole family's well-being. And that's not considering the child, who has often been stuck at home for a year, 2 years, sometimes 3 years, because a school says they cannot accommodate them. And when you find that pathway through to education, through support or through knowing which schools are accommodating, the change in the family is absolutely palpable. And we hear stories from mums and dads where they tell us that it's changed their life, their child is so much happier, they're with their friends. And it's heartbreaking sometimes hearing how negative it can be when the barriers are not broken down.
Thank you. I just wanted to mention to the audience to be aware of M42 social media platforms, and to a little girl called Amna that we will be posting far more information about. Amna is a young lady with complex medical needs in a ventilator who has just started at a mainstream school in Abu Dhabi. She is in school right now. I do believe. I haven't had a message that she's not. So I want you to understand, and you only have to look at her face. And I want to stress, it's not so much for Amna. The principal of the school said to me that in 3 weeks of her being at this school, the difference that has made to everyone else in the school, the growth in terms of inclusivity. So it's really important, and I thank you for raising those points. Now, just as we come towards the end here, there may be time for a question or two. But just to the panel, one thing. what one thing would you like to see improved within society to further enhance inclusivity across the UAE? I'm going to limit you to one thing. I think maybe reiterating something that you've already mentioned, but that'd be really interesting to understand what, from your perspective, one thing that you'd like to see improved.
I'd like to shift the narrative around inclusion from a woe is me and it's all miserable and terrible to celebrating those who are successful.
Fantastic. So celebration.
I would like to see people of determination in the driving seat, just leading the changes, also in the board of directors, so in leadership roles.
I'm not sure, but I think, as Mariam mentioned, the awareness or the mindset of everyone around, and because inclusivity is not the job of the organizations or the government or somebody else, but it's everyone have a role in that. And I think having everyone participate in that would be very important thing, and they cannot get there without the right awareness and knowledge about inclusivity.
Absolutely. Suaad?
I am aligned with what they mentioned. And to add to that as well, sometimes we get very busy on our day-to-day job. We get busy with presenting, meetings, taking calls, etc., and we forget the bigger cause. So taking these, they could be very small steps of impact that once we're much older, we look back and we appreciate that we've done something for the society, our community, and our kids.
Thank you very much. Is there a question? Anyone would like to ask a question from the audience? We've got time for a question. Don't feel compelled. Neil.
Thank you, Kevin. I'd like to pick up on something that Dr. Catherine said, that change needs to start with education. One of the things that I notice when I come to the region is that a lot of these centres are classed and billed and marketed as centres for rehabilitation of people of determination. And you're not going to rehabilitate and cure someone with Down syndrome, someone with autism, someone with cerebral palsy. So maybe change needs to start with the language that we use in those education centres to begin with. I'd like to see what the panel think about that.
I think this is quite a challenging concept, because sometimes the translation from Arabic to English doesn't flow smoothly, and a lot of the words don't translate directly, and sometimes what is translated professionally into English is not the true meaning in Arabic, as I have learned the hard way over the years, thinking that's a terrible way to put it, but in fact in Arabic it's a different connotation. So it's a more complex challenge than just the understanding of that rhetoric. Would you agree?
Yeah, I think a lot get lost in translation. But yeah, we've been discussing that earlier, that a lot of people think about the rehabilitation or curing the disability, but it's not something to cure or to get rid of, but to live with and to have them included within everyone, because all of us have some kind of need or special need in each of us. So we are all the same, but we have different levels of needs and different levels of special need.
Yes, and absolutely, Neil. I think that understanding what we mean by that language, it's a confluence of many languages and cultures here, and I think understanding meaning is really important. One thing that we do see that is really changing here is the move from a health model to a social model, and I think there'll be language within that explains what is it that we mean, but moving towards that social model of support is absolutely where healthcare is moving and needing to move to recognize this is not just something to be cured, but actually to be worked through, and environmental alterations or changes is extremely important. But thank you for your question. I think just as I close, I just want to be able to say that we all choose to live within an inclusive society, as Salem had mentioned. People of determination are very much part of our society. Listening to what they want to achieve is imperative to the growth of our society, and removing barriers and working towards and introducing reasonable adjustments are vital cogs towards that goal and a much healthier society. And I want to thank my esteemed colleagues for helping to illustrate that a little bit more, that it is an inclusive society is very much a healthy society. Thank you very much, everyone.